Why does bile acid dysregulation lead to CFG discomfort? Imagine your body as a finely tuned machine where each part has a role in keeping everything running smoothly. In cystic fibrosis, a key part of this system gets disrupted, especially in how your body handles bile acids. Bile acids are essential for breaking down fats from your food. They are made in the liver, stored in the gallbladder, and released into the small intestine to help digest fats. Normally, after doing their job, they are reabsorbed in the last part of the small intestine called the ileum, and then recycled back to the liver. This process is called the enterohepatic circulation. In cystic fibrosis, the defective CFTR protein affects how bile acids are secreted and reabsorbed. Because of this, fewer bile acids are reabsorbed, and more are lost in the stool. This loss means that there are not enough bile acids in the intestine to properly emulsify fats. Without enough bile acids, fats from food are not broken down efficiently, leading to fat malabsorption. This causes fatty stools, known as steatorrhea, and can result in nutritional deficiencies because the body isn't absorbing vital fats and fat-soluble vitamins like A, D, E, and K. The altered bile composition in cystic fibrosis also irritates the lining of the gut. This irritation can cause inflammation, leading to symptoms like bloating, abdominal pain, and general discomfort. Additionally, bile acids normally activate specific receptors in the intestine that help regulate bile acid production and maintain balance. When this signaling is disrupted due to malabsorption, it can cause further imbalances in bile acid levels, worsening digestion issues and possibly affecting liver health. Another important aspect is the role of the CFTR protein in the bile ducts. It helps regulate the flow and consistency of bile by controlling chloride and bicarbonate secretion. When CFTR doesn't work properly, bile becomes thicker and more viscous. This thick bile can block bile flow, leading to bile duct obstructions and liver problems, which can add to gastrointestinal discomfort. All these factors combined explain why people with cystic fibrosis often experience gastrointestinal symptoms like bloating, pain, and difficulty digesting fats. Managing this involves strategies like pancreatic enzyme replacement therapy to improve fat digestion, vitamin supplementation, and sometimes medications that help regulate bile acid levels. Understanding how bile acid dysregulation affects digestion helps healthcare providers develop better treatment plans to improve nutrition and reduce discomfort. Remember, each person with cystic fibrosis is unique, so it's always important to work closely with your healthcare team to find the best approach for your specific needs.